What I'm about to demonstrate is an example of being a therapist A versus therapist B. And I want you to decide which therapist you think would get optimal results. And here we have our sample hypothetical patients with us. So I just want to emphasize it's not real, but we're going to walk through it. So nice to see you. Now, after testing your back, because I know you've had this back pain with pain shooting down your leg for a long time, correct?
Yeah.
Now, I know you've seen many people, but I've just assessed you. And I'm going to tell you that what you have is a pinched nerve. We call it sciatica.
Okay.
Now, sciatica is, a lot of people have it, and you need to Google it if you haven't Googled it.
Okay.
Look for the word sciatica. And the cause of your sciatica can be complex, but I think yours is probably from a bulging disc. Look at this disc. See how this red thing is sticking out?
Yeah.
As it's sticking out, it's hitting that nerve. And as it's hitting that nerve, it's pinching it. Now, behind that bulging disc is also facet joints. Those joints also have arthritis in them in you. Because remember you got your x-ray and it showed you have degenerative disc disease?
Yeah.
That's old age. And your spine, I know you're young, but you're
Yeah.
like a 7-year-old spine you got. So it's pretty old that you got. I don't know how that's happened to you, but it's in rough shape. You also have some stenosis. Stenosis means this narrowing of the holes where the nerve roots come out from. And it's even further pinching it. So not only do you have arthritis of the joints, you have disc degeneration. It means your discs are narrowed now because there's water is gone out of them. Old age again. Now, I don't know why you're getting old so fast, because of all the traumatic things you've done, or maybe your spine's been out of alignment for over the years. So it's really bad.
Okay.
So the other thing I have on top of the bulging disc, sometimes this disc ruptures. And if it ruptures, all this fluid goes and pinches the nerve more, that's when you need surgery, right? And so sometimes the disc can go back and press on the spinal cord, and that can cause people to become paralyzed and you end up in a wheelchair. Now, that doesn't happen too often, but if you were a horse,
Okay.
you're not a horse.
What happens?
But the thing is, you know what? This is pretty bad, this pinched nerve that you have, and I know the pain down your leg is pretty bad. You may need surgery. Google that also, back surgeries and stuff. Look on the internet and see what things you can find. And we're gonna try some physio. I don't know if it's gonna work or not, but we're gonna try it. If it works, great, but if not, I'm gonna send you off to see specialists and more tests and diagnosis. And maybe we have stronger drugs.
I don't want to take drugs.
Yeah, but you don't have a choice. So that was therapist A. Now let's continue with therapist B as an option. Nice to see you.
Hi.
Hi. So you know how you have this back pain with pain going down your leg?
Yeah.
Yeah, and I just want to make sure that you realize it's a very common condition. You've heard of
Okay.
the term sciatica, you've probably been told.
Yeah, I've heard of that.
And it's very common. The first thing I want you to know is that I've seen hundreds of them over the years.
Okay.
And that's the truth.
Yeah.
And the far majority of people with sciatica get 100% better.
Awesome.
That's what.
Yeah.
That's really
good.
important
Yeah.
that you realize that,
Okay.
and they get better. And time makes it better. And with therapy, sometimes it speeds it along, which is the important thing. But the most important thing is, as you're recovering, that you don't get out of shape in the meantime, though.
Okay.
As you're
Yeah.
recovering, which you will.
So I can still
Now-
do stuff.
Yeah. Now you may be wondering what's the cause of this. The cause of this, we're going to say, is your nerve, obviously, that's causing this. But the word we like to use is called a sensitive nerve, is what you have.
Okay.
A sensitive nerve is, the nerve is irritated, let's just call it. Another word for irritation is that it's inflamed.
Okay.
So when it's sensitive or irritated, that's why small movements make it worse. However, the treatment for a sensitive or irritated nerve is to try to move actually as much as possible.
Okay.
And the reason that's important is because you may have noticed it hurts the most when you haven't moved for a while.
Yeah.
For example, when
Yeah.
you sit for a long
Yeah,
time.
getting up is
Getting up. Or when after you've been in bed for a long time, getting out of bed is worse.
Yeah.
So the best thing you can do throughout the day, as much as you can, is move. However, what movement? It depends on which movement makes you feel better. And that's our job to figure out today. What we
Okay.
know the best treatment is exercise and movement.
Okay.
And the more you move, the better it is. However, the movement, some of the movements may you say, oh, I feel worse a little bit. But even if you feel a little bit worse, it doesn't matter. It's just the nerve that's sensitive.
Okay.
And you'll gradually, of course, get better and better and recover as you do this. So the
Good.
secret is
Yeah.
go in the directions that make you feel better, especially if it takes the pain away from your leg. That's a positive exercise.
Okay.
Exercises that generally make your leg feel worse, we say, you know what, let's avoid that for a little
Okay.
while.
So don't do it if it hurts.
Yes.
Okay.
But generally staying active, whether it's swimming or treadmill. And we're going to do stuff with my hands, manual therapy stuff, to see which movements may make you feel better. But that's
Okay.
only for the short term and temporary thing.
Good.
All right?
Yeah.
How do you feel?
Pretty good.
Good.
Yeah.
That's it.